Good evening, everyone. My name is Efa Moronta, and I'm a family nurse practitioner student from Franklin University. Today, I'm gonna speak a little bit about a patient who is a female, 84 years old, who came accompanied about one of her grandchildren to the office and complaining about joint pain for the past month without taking any medication to relieve the symptoms. She's a married patient with two children. The patient is a retired teacher who currently operates a fish joint business. She's she's a witness. She was married, but her husband passed away a couple years ago. She has a history of chronic conditions such as overweight, chronic cough, and diabetes type 2. The patient confirmed that one of her grandchildren will be her proxy, and due to the good relationship between them and that they two possess. The grandchild spent most of the time with the patient, and since they live together, and she also will help the patient to manage her conditions and monitor her vital signs. During the session, the patient was active and tentative. She participated by responding all the questions that aid in examining and diagnosis her conditions. She offered detailed information regarding her illness. In addition, the patient responded positively to the treatment plan by applying the recommended measures and adhering to the prescribed medications. She was accompanied by her grandchild, who was less involved in the conversation since the patient could provide the required information and make informed decisions. The family member only participated in the conversation during the patient education and non-medication measures, such as maintaining her body weight, and also the family member will also help in the patient to adherence to the provide medication and the follow-up visits. The patient insists to actively participate in the conversation without the help of the family member. The main patient goal is to reduce the pain and the stiffness associated with her osteoarthritis. And to achieve this goal, she might need to follow the prescribed medication, to take all this medication and also try to lose weight as much as she can. The patient grandchild also will help to ensure that the patient take the medication as it is indicated, and also to go all to the follow-up visits. The patient goals is feasible since she is willing to take the necessary measures to achieve it. In addition, the patient has a support system that will help her to adhere to the plan. Interventions. The following interventions were provided to the patient in order to improve her symptoms. Pharmacological treatment, non-pharmacological treatment, and also following with the patient in the next couple months. And the pharmacological treatment, we're going to start with metformin 500 milligrams, one tablet twice a day. Fish oil, one tablet once a day. Acetaminophen, 325 milligrams, two tablets every 8 hours as needed. And we're gonna also to start salmeterol inhalers to help her with the chronic cough. And the non-pharmacological treatment, we're gonna recommend her lifestyle changes, such as exercise herself consistently, try to lose weight, and consuming a very balanced diet. Follow-up visits, the patient was also recommended to continue coming to the office. I would like to see her in a month, and also possibly I would like to see her in the next 2 months to do like a blood test to make sure that the diabetes and all the chronic conditions they're being in control. Barriers. There were not significant barriers during the encounter and the physical examination. The patient was accompanied by her grandchild, which eliminated possible languages barriers. She was well informed about her medical health, which aid in the successful competition of the discussion. However, the barrier encountered during the conversation was linking about the patient's symptoms that can cause discomfort during the conversation. She complained about joint pain, making it difficult to handle it of the mayor's area's comprehensibility. As confirmed by her in her case, the patient chose to manage her weight and avoid further complications due to the overweight and diabetes. According to the healthcare proxy law, the patient and the grandchild are expected to sign the proxy document, which is later filled for future reference. She is expected to sign the document prior, after which the proxy will be capable to making decisions for her in the future. The Patient Health Determination Act would help the patient to make informed decisions regarding her care. Giving the patient essential knowledge will allow them to engage in decision making. That Patient Health Determination Act will also help to protect all her rights and ensure that she receives the quality of care. It also will help to ensure that the patient receives the required care and providing them with the necessary information. Additionally, that Patient Health Determination Act will also help to protect the patient's rights and ensure they receive quality of care. Living Will and Advance Directive. In this case, the patient has appointed that her grandchild as her proxy decision maker. This means that if the patient, in case that the patient cannot make decisions by herself, she has her grandchild will be responsible to make these decisions for her. The grandchild is being involved in her patient and all this patient care, and she is very familiar with all her medical conditions. And during the encounter, discussing with the patients and the family member advance directive is pretty important, as they need to be aware about their wishes if they cannot decide by themselves. The durable power authority of health care. A durable power authority of health care is a legal document in which an individual appoints another individual to make decisions pertaining case that they're unavailable to do it. This kind of document give the agent the authority to decide on the principal health care situations, including medical care, hospitalizations, and end of life care. The principal wishes as represented in the agreement must be followed by the agent, who must also operate in the principal best interest of the patient. The agent also will make all medical decisions if the principal is unconscious and unavailable to express their wishes. It's crucial to understand that the durable power authority of health care will go into force once if the principal is incapable. Medical order for life-sustaining treatment. This form is a document that outlines of a patient wishes for end-of-life care. This is complete by the patient physician and the patient, and both needs to sign them. This form will document the patient preference for life-sustaining treatment, such as artificial ventilation, resuscitation, and feeding tube. Also, it is important that all the family be aware about the patient wishes. In this case, the patient would like to be resuscitated. Decision-making capacity. In this case, the patient has the ability to make informed decisions based on her understanding of the situation and the ability to communicate herself. She's alert and oriented in all spheres. She can communicate her symptoms and history. She can also understand the risk of the medication that will be prescribed. Additionally, the patient can make decisions based on her beliefs and her values, preference, and also she can understand the situation. Palliative Performance Scale and Karnofsky Scale. This scale rates the patient functionality status on the scale 0 to 1. When 0 is the patient is dead and 1 is the patient is in a perfect condition. Also is a good reliability and validity and a predictor mortality. The Karnofsky scale, on the other hand, is a scale that read the patient function status on a scale of 0 to 100, when 0 is the patient is dead and 100 is the patient is in a perfect health. Is a good reliability and validity and is a predictor of mortality. Based on the information provided, the patient will likely fall between PPS 40 and Karnofsky of 60, which means that the patient's functional status is a third poor and her prognosis is not too good. The patient pain reduced the range of motion and lack the response to medication indicate poor prognosis. Thank you so much for your time and you have a good day.